Good day, medical entrepreneurs. Today we'll discuss Tesamorelin, a synthetic peptide analog of growth hormone-releasing hormone, GHRH. This medication is FDA-approved for specific indications but has broader applications in clinical practice. By the end of this session, you'll understand everything needed to safely and effectively prescribe Tesamorelin, including its mechanism of action, indications, dosing, expected benefits, potential risks, monitoring, and alternatives. Tesamorelin mimics the action of endogenous growth hormone-releasing hormone. It stimulates the pituitary gland to release growth hormone, which subsequently increases levels of insulin-like growth factor 1, commonly known as IGF-1. This cascade of hormonal changes promotes lipolysis, the breakdown of fat, and modulates anabolic processes, contributing to body composition improvements. Importantly, Tesamorelin acts upstream, preserving normal feedback regulation of growth hormone production. Tesamorelin is FDA approved for the reduction of excess abdominal fat in patients with HIV-associated lipodystrophy. However, it is also used off-label for non-HIV-related visceral adiposity, age-related decline in growth hormone levels, body composition improvement in metabolic syndrome, adjunct treatment for growth hormone deficiency syndromes, where stimulation of endogenous secretion is desired. Patients treated with Tesamorelin can expect reduction in visceral adiposity, particularly intra-abdominal fat, improved lipid profiles including reductions in total cholesterol and triglycerides, increased lean body mass due to anabolic effects, potential improvements in quality of life through enhanced energy, physical strength, and endurance, better glucose homeostasis in some individuals, although careful monitoring is required. Recommended dose. The typical dose is 2 milligrams injected subcutaneously once daily. Administration tips: rotate injection sites to avoid local irritation. Instruct patients to administer the injection at the same time each day, preferably in the evening. Reconstitute the lyophilized powder with the provided sterile diluent following aseptic techniques. Pharmacokinetics. Absorption. Subcutaneous administration ensures systemic bioavailability, peaking approximately 1 hour post-injection. Distribution. Tesamorelin has a rapid distribution phase and predominantly acts on the pituitary gland. Metabolism. It is metabolized into inactive peptides through normal proteolytic pathways. Excretion. Clearance occurs via renal and hepatic mechanisms, with no significant accumulation under normal conditions. Pharmacodynamics. Tesamorelin's effects are mediated through the pituitary, increasing growth hormone and downstream IGF-1 levels within hours. The lipolytic and anabolic actions emerge over weeks, with peak reductions in visceral fat observed after 3 to 6 months of consistent treatment. Common side effects include injection site reactions, redness, swelling or pain, musculoskeletal complaints, joint or muscle pain, metabolic effects, increased fasting blood glucose levels or reduced insulin sensitivity, neurological effects, mild headaches or dizziness, rare but serious risks, hypersensitivity reactions including rash or anaphylaxis, potential exacerbation of pre-existing malignancies, as growth hormone and IGF-1 can stimulate cellular proliferation, fluid retention manifesting as peripheral edema or carpal tunnel syndrome. Before therapy, baseline growth hormone and IGF-1 levels, comprehensive metabolic panel including fasting glucose and hemoglobin A1C, lipid profile, thyroid function tests, tumor screening if cancer history is present. During therapy, monthly monitoring of IGF-1 to ensure levels remain within the age-adjusted physiological range, quarterly fasting glucose and hemoglobin A1C, periodic liver and kidney function tests. After therapy, reassess IGF-1 levels post-cessation, evaluate metabolic and cardiovascular markers for sustained benefits or adverse trends. Alternatives to Tesamorelin: direct growth hormone therapy, indicated for severe growth hormone deficiency, provides more potent effects but lacks the physiological feedback regulation of Tesamorelin. Lifestyle interventions, focused dietary changes and exercise regimens targeting visceral fat reduction, may be enhanced when combined with Tesamorelin. Other peptides, growth hormone secretagogues like sermorelin or ipamorelin, may serve as alternatives with varying potencies and indications. Pharmacological options, anti-obesity medications or insulin sensitizers like metformin for metabolic syndrome patients. Tesamorelin offers a targeted physiologic approach to growth hormone modulation with proven benefits in reducing visceral fat and improving metabolic health. When prescribing tesamorelin, focus on careful patient selection, ongoing monitoring, and addressing any adverse effects promptly. By integrating tesamorelin therapy into practice, you can offer patients a safe, effective tool for improving their health and quality of life. Make sure to download the one-pager on tesamorelin. Link is in the bio.